The National Teenage Pregnancy Strategy has been highly successful in reducing rates of teenage conception by over 60% in 20 years. However, in the East Riding, which has a lower than average rate, in 2020 there were still 77 conceptions to under 18s, 61% of which led to abortion. Teenage parenthood is associated with a range of risk factors for both parents and children. In pregnancy, the risks of a low birth weight baby, stillbirth, and infant mortality are higher for babies born to teenage mothers, who are also more likely to be smokers and less likely to breastfeed than older mothers. Teenage mothers are more likely to have poor mental health, to be not in education, employment, or training, to have been eligible for free school meals, and to have been in care or a care leaver. Young fathers are more likely to have been subjected to physical or sexual abuse, have pre-existing mental health conditions, or to drink, smoke, or misuse other substances. Access to contraception is key, including emergency contraception, which is available within our communities at many pharmacies and through school nurses. As with all sexual health services, it is crucial to ensure safeguarding of young women, particularly those under 16. The Family Nurse Partnership, which has been recently recommissioned in the East Riding, provides intensive support to teenage and vulnerable parents up to their baby's second birthday and has shown improved health and life outcomes for young parents and their children. In the current cost of living crisis, when young people may see their parents struggling, it's more important than ever to foster aspiration. The introduction of statutory relationship, sex and health education with a whole school approach can be instrumental in achieving this.
Smoking is one of the biggest causes of death and illness in the UK. 78,000 people in the UK die from smoking. Smoking increases your risk of developing more than 50 serious health conditions. Smoking increases inequalities. People who are unemployed are twice as likely to smoke, and 16.8% of people in a manual and routine job will smoke. Smoking during pregnancy is also a major health inequality, with prevalence varying significantly across communities and social groups. East Riding, while declining, has a 12.3% of mothers smoking at the time of delivery, significantly higher than the England average. Mothers in routine and manual occupations are 5 times more likely to have smoked throughout pregnancy compared to women in managerial and professional occupations.
Women's reproductive health has lifelong impacts from puberty through to the menopause and beyond. For the most part, it's not about dealing with illness, which is perhaps why it's been given a low priority, but about improving the quality of women's lives and giving them the good reproductive health they're entitled to. Taboos and stigmas can prevent women from seeking help and can reinforce beliefs that debilitating symptoms are normal or something to be endured. And some populations, such as Black women, are more likely to face inequalities in healthcare and not be heard. Many of the issues affecting women will also affect trans men, non-binary people, and people with variations in sex characteristics. The impacts of not providing good women's health include girls missing school during their period because of unmanaged pain or bleeding, or through period poverty not having access to sanitary products. Lack of access to contraception, meaning women have no control over their fertility, whether unplanned pregnancy or choosing when to start a family. This was made worse during the COVID pandemic by lack of access to face-to-face appointments at GPs or in clinics. Maternity care that is unsatisfactory and in extreme cases unsafe, leading to adverse outcomes for women and babies. Older women not able to function to their full capabilities due to lack of healthcare and understanding during the menopause, and the risk of underlying health conditions not being picked up. The forthcoming National Women's Health Strategy received nearly 100,000 responses from women who felt their voices were not heard in the health system, but we need to ensure that national policy is translated into local action for the benefit of all women in our area.
Like adult mental health, children's mental health is also on the rise. Again, the pandemic has hit children and young people hard. Having several breaks in education, unnatural transitions through school years, and not being able to learn, play, and be social at key points has affected children's development and had a major negative impact on their mental health. We are constantly putting out the fires in regards to mental health. We need to start looking into more preventative approaches and start going to the place where the logs are being thrown onto the fires to see our future generations thrive. Working better with schools and communities to develop a more robust approach to mental health is the way forward. Embedding mental health education into the school day to allow our future generations to become more resilient, understand their bodies and brains better, and be able to rationalise why they may be feeling low or having changes in moods. Teaching them how to maintain good mental health, where to go, and how to support one another is essential to give our future generations the tools and the best chance, and in time alleviate some of the mental health burden we so constantly see in later life.
Healthy schools are beneficial in educating our children and young people in healthy lifestyle choices, such as promoting physical activity, looking after our mental health and well-being, and relationships and reproductive health. The pandemic's had a huge impact on our children, from school closures to isolation and not being able to spend time with family and friends, which has had a knock-on effect to their education and their subsequent lifestyles. In 2021, only 44.6% of children and young people in school years in England met the guidelines of taking part in physical activity for an average of 60 minutes or more every day. It's imperative that we recognise the important role schools have in educating our children and our young people in creating a healthier population. We have the opportunity to create an environment with a focus on well-being based on the needs of the children and staff, changing the culture and making it a sustainable ethos change.
Today, nearly a third of children aged 2 to 15 are overweight or obese, and younger generations are becoming obese at earlier ages and staying obese for longer. In East Riding, the number of children living outside an unhealthy weight range is comparable to the England average. Living with a BMI above the average score as a child increases the chance of living with an increased BMI in adulthood, which is linked to a number of other physical, mental, and social health issues. 31.8% of children in Year 6 are classified as overweight, obese, or severely obese. This has increased yearly since 2006-2007. Obesity has impacts on people's ability to create social connections. It also has a link to unemployment, living in poverty, and attainment. The COVID-19 pandemic and cost of living has had a negative impact on children's physical activity levels and opportunity to eat well. This in turn leads to the possibility of increased learned unhealthy behaviour that could follow into adult life.